WEO, Caring for Health Every Day. Application Guide for Suction Catheter. Product Composition. WEO suction catheter consists of an adapter, a tubing with anti-harm tip, and sputum collecting bottle. Main types. WEO suction catheter has two main types: standard anti-harm type, standard anti-harm sputum collecting type. Key features and functions. The round boss makes the tip of the product more smooth, which can reduce the friction between the product and the inner wall of respiratory tract of patient. The edge design can prevent the side hole of suction catheter fitting into the inner wall of respiratory tract to avoid bleeding caused by too large negative pressure in the aspiration treatment. Sputum collection bottle can be equipped to prevent cross-infection. Instructions. Standard anti-harm type. 1. Evaluate the patient's condition, consciousness, cooperation, breath, frequency, rhythm, depth, whether hypoxia, oral and nasal conditions, sputum traits, color, viscosity, and amount. 2. Take the patient to the bedside and help the patient to get the right position. 3. Connect the aspirator, turn on the switch, and check the performance. 4. Adjust the negative pressure, wear the gloves, connect the aspirator with the suction catheter, and test whether the saline inspiring is smooth. 5. Tilt the patient's head to one side. Insert the suction catheter into patient's trachea after sucking out the oral pharyngeal secretions. Precautions. 1. If severe cough occur, the patient should have a rest. 2. Suck out the sputum. Do not take more than 15 seconds each time to avoid hypoxia. 3. To prevent from being clogged with sputum, flush the catheter with saline after use. 4. If oral sputum aspiration is difficult, and insert the suction catheter through a nasal cavity. Insert the suction catheter through the trachea, intubation, or cannula in patients with tracheal intubation or tracheotomy. Thinner suction catheters should be used for pediatrics. 5. If the sputum is viscous, pat the patient's chest and back, or alternately use ultrasonic atomization to inhale or slowly drip the saline or phlegm medicine to dilute the sputum for easy aspiration. 6. Wipe out the discharged secretions. Observe the change of respiratory frequency before and after sucking. Pay attention to the nature, color, viscosity, and amount of the aspirate, and then record. Standard anti-harm sputum collecting type. 1. The suction catheter of sputum collecting type shall be used if sputum collection is required. 2. After the operation, unscrew the collection bottle, cover the cap of the bottle, and send the sputum to culture. 3. After sucking out the sputum, turn off the aspirator switch, fold the suction catheter with gloves and discard it. 4. Clean the patient's nose and mouth. Help the patient return to comfortable position. 5. Instruct the patient to drink more water, cough spontaneously, and change position to facilitate sputum discharge. 6. Organize the materials. Wash hands. Record and sign.